This is the Monday meeting. This is the 6th of July, 2020. Very pleased to be welcoming you. Thank you to all those of you who submitted and completed all of the pilot application information. This is really the key step, and you may now consider yourselves, as we said last week, founding members of the COVID-19 Scholar Peer Hub, and you consistently, week after week, joined these sessions to help us think through and actually develop the Peer Hub, and therefore are now those who will continue to help guide us and find our way to make sure that this new initiative is useful, and the more immediately, the more practically so, the better for people who are trying to figure out how to maintain immunization services, how to prepare recovery during the pandemic. So we first are going to get an update from about the ideas engine from Ian Steed. Then we'll be going, today we had Friday, a very important meeting of all the team leaders. It has been 1 year since the team leaders of these scholar country groups actually made the commitments to serve their country's scholars. And pretty much all of them have done so with diligence, with consistency, with coherence, supporting scholars, making the critical linkage to the national EPI team, and so on. And so that is, we're going to do something special for team leaders today. And then, as promised, we're going to share the results, what is changing about the COVID-19 situation and how it is affecting immunization services. So that will be the second part of the meeting. I myself will be taking leave at 25 past. And so my colleagues, Charlotte Mbou, Ian Steed, Alain Blestatsinku, will be taking it from there. But I'll be with you for the first half of this meet. So let's start with the ideas engine update. Ian Steed, welcome to you. How are you doing? And what's happening with the ideas engine? What would you like to say to scholars who are here today?
Good afternoon, Rada, and good afternoon, good evening, and good morning, everyone. This is Ian speaking. Very best wishes from sunny Cambridge. So, Rada, Ideas Engine. As we mentioned last time, we are in a phase. We are reviewing what happened in the pilot of the Ideas Engine. So we need to thank all of those scholars who have taken the time to fill in the survey. And in particular, those scholars who may not have got onto the Ideas Engine and have still taken the time to fill in that survey. That's really important because it tells us why people haven't engaged with this. And there may be some things we can do to make that easier for the exercise in the Peer Hub, when we will have hundreds more scholars joining the Ideas Engine. So that's the phase we're in at the moment. What that means is that for the 30 or 40 people each day who are still going into the Ideas Engine, having a look, you can add comments, you can read what people have written, you can vote, but you can't add new ideas. So it's very much there. The material is there. It's open for comment and voting. It's not open for new ideas, but it will be. We're using the data that we're gathering from the questionnaire and from analysing what people have shared through the Ideas Engine to reformulate a few things. We'll be looking at the application form information that's coming in from the scholars who are applying to the Peer Hub to say, do we need to add or reformulate some of the challenges, and we'll use that so that in a couple of weeks we'll be ready to reopen it to new ideas, to new material coming in.
Great, thank you, Ian. And I think on behalf of the Scholar team, I want to add my thanks to all those of you who have already completed the feedback form. Especially appreciated the feedback on the Ideas Engine from people who simply didn't have time to access it, or who had difficulties and challenges, even though you haven't been able to benefit. That's why we need your feedback, so we can make those improvements and make those adjustments. But overall, just want to say once again, scholars have Yes, every time we ask, you answer. And one of the reasons we're going to be sharing the results of the COVID-19 Peer Hub pilot application is to, in line with this commitment that we have, to share with the network, to share with the founders of the network what you told us and what that can tell us about what is happening, what is changing with the pandemic, and how it's affecting immunization services. Now, for this next one, I want to add a little bit of add a little bit of music, and you may wonder why. It has been 1 year since a group of 24 scholars made the commitment to serve other scholars from their countries. And I'd like to turn to Alain Blestatsinku to explain what that means, why that is important. Alain?
Yes, Reda, good afternoon to everyone. So I'm really happy, like you said, since last year for the Impact Accelerator, team leaders volunteer themselves to support scholars, individual scholars, implementing their project or trying to, and they provide various kind of support on a voluntary base. So we would like to really thank them for all that work, and we know the results are there. So we were having a meeting on last Friday with team leaders, and it was very exciting to see the team leader. It was an opportunity for them to contribute to the Peer Hub with suggestion on forms, but also giving us an update about what is happening at the country level, and the most important is how can we do that better? How can we support better scholars at the country level? And that is particularly important because we know that now is the COVID-19 affecting immunization program. So their support to individual scholars contributing to improve their day-to-day work was tremendous. So I would really like to thank them. Yesterday, Friday was a meeting that was very productive, and we also seized the opportunity to explain to them what is the Peer Hub and the component, and then we are looking forward next Friday to continue the narrative, the discussion with them. But we really want to thank them rather individually, because we know what is take to be a team leader, and they also reiterate they are willing to continue to support scholar at the country level. And they were also happy to see Charlotte presenting the statistic of what was the report, how the report looks like at that time, what is implemented at the country level, and that was awesome. So again, I would like really to thank them, to thank all the team leaders in the room here, and especially those who contributed a lot. I can see Mohammed, Mata, and Ibrahim. So really thank you to them, and then looking forward to continue the adventure with the COVID-19 where we need us the most. Thank you, Reda.
Great, thank you so much, Alain. So indeed, we provided essentially zero support to the country team leaders. They decided to volunteer to support scholars from their countries. And we asked a question: would they uphold their commitment? Would they carry through? And the answer is resoundingly that they have. Whatever the challenges in their particular countries, however the country group has turned out, they are still there, still working to serve their country scholars, and still very much committed to honoring and upholding the scholar pledge for immunization. And now the good news is that, as you will see, there is an impressive number of founders of the Scholar Peer Hub who've been participating in the pilot, helping to build and figure out what the Peer Hub actually looks like, who have already volunteered to either support the team leader, to take over if it's a team leader who's tired, who's given a lot, and who's ready to let go, and to serve as COVID-19 focal points. That'll be in the second half of the presentation. But before we do that, I would really like to do the following, is to ask everyone, if you're sitting in front of your computer or your phone, this may look a little odd to your colleagues, but I would like to offer a round of cheer and applause, hoorays, if you will, to the team leaders, whether they're here with us now or whether they'll be watching the recording. We know how busy they are, of course, that has not prevented them from honoring their commitments. So on 3, I would like everyone to get ready to clap as loud as they can. And as you can see, despite distance, we will defy distance to make noise and cheer our team leaders. Ready? 1, 2, and 3. Another round of cheers for those of you who have, in the pilot application that you've now filled out, volunteered to serve as team leaders, support your existing team leader, or serve as COVID-19 focal point. All right, this all started when we started seeing testimonials like this. As you can see, we're still here, but parents don't bring their children for vaccinations anymore. And because we're going to give you an update based on the very small sample of the most, but a very reliable one, of the most dedicated and committed scholars that you are, if you are in this room, if you're still here, we wanted to see, it is because of your commitment and dedication. So here are the numbers from April 2020 from the survey done by the Geneva Learning Foundation with WHO. You can look up the details in the Global Immunization newsletter, an excellent article by Jill Milbal. And here you can see the impact of COVID-19 on routine immunization. This is what over 1,500 scholars in the network told us was happening. And then we're going to give you the update with a small sample, so there's some limitations there, but and you could see that this was the situation in April. All right. So now we are, before I share with you the results and probably hand it over to my colleagues, I'll be going to another meeting at the 25-minute mark. We are really experiencing something, of course, unprecedented is the word that comes back so often. The foundation in the pandemic, the foundation of a group, a foundational moment of people who come together because they want to, not because of any other reason, and with no ambiguity or nothing equivocal about that commitment. You know that in the application you signed 3 commitments plus a sworn statement to indicate and spell out what those commitments are. So these are not to be taken lightly. And this is a foundational moment for us. So, as I said, we tried to really bring together the core group of the most committed, dedicated individuals within the scholar community. And we selected you because week after week, despite the many challenges and despite how busy you are, you were in attendance and you were here. And so altogether, 242 people submitted applications and can now consider themselves founding members. So here we have the Francophone founders, and you can see the list of countries here. And this is just a pilot. Let me move myself out of the way. So this is just the pilot. This is not the, we have not even launched the Peer Hub yet. And of course, we'll have an event, especially for that. More Francophone founders. Whoops, I think my, yeah, I'm going to have to keep myself somehow in. More Francophone founders here. Yes, they are greater numbers. And we know that the Anglophone scholars will be known for the quality of their commitment. More Francophone founders here, you can see from many different countries. And then here is the list of, final page of Francophone founders. And then these are the individuals who completed the application by the deadline by Sunday evening. And this is the second page. So you can see many countries represented, one country, Nigeria, every time. Nigerian scholars demonstrate an exceptional commitment and dedication and are, of course, from a very large country with a very large population. So we want to honor our Nigerian scholars, even though unfortunately, our Nigerian scholar team leader is not able to be with us today. So that is the situation now. We are taking time to get things right with respect to the formal and more public launch of the Peer Hub. And in the meantime, I want to share with you, let me see how much time. Okay, I've got 10 minutes. I'm going to try to give you a quick recap of what you told us in the application. So let me go to that. And you can see we have almost 40% women and 60% men who applied. So this is a very small number compared to the numbers we're likely to get. Remember that for Teach to Reach, we had over 2,000 applicants. This time we will be selecting individuals. Let me see if I can make improve the quality of the graphics here. Yeah, and I know, all right, if the screen is blurred, we'll be sharing the slide deck with you, and on the recording, the screen will not be blurred. That's a bandwidth issue, unfortunately, depending on where you are and at what moment of the day. It's actually Zoom is reducing the bandwidth that they're making available to webinar customers, so there's nothing we can do about it, unfortunately. All right, you can see right now what we have from the core group, the most committed and dedicated scholars. You can see here, it was 26% subnational, surprisingly high proportion of NGO, folks from civil society, consultants, and then a small but very important proportion of national level MOH staff. Our focus is really not on any one specific level within the system, but rather bringing together people from across the country, across the different levels of the system, and saying we have much to learn by working together, by collaborating, by talking to each other. Right. And you can see most people here are working at the subnational level, including almost a quarter from who are working in a health facility. And it has taken us, it's only starting in year 3 of the Scholar program that we began to see people from the health facility level with the right internet access and with the right dedication and commitment to be able to succeed in Scholar courses. In terms of countries, obviously, you can see here that more than half of the core group is from Nigeria, followed by Ghana, India, Kenya, and Pakistan. So you see it is not necessarily the population of a country or the size of its health system that determines the number, the level of commitment, and the provenance of the core group. Experience, there's a wide range, as you can see here. Same for outbreak response for VPD. Now, right now in the core group, this is a situation. The picture may look very different once we open up applications and formally and publicly launch the Peer Hub. And I join Felicia Aibi-Nuomo in her congratulations to Nigerians for the commitment, as well as all the other countries that are represented here. Immunization staff trying to maintain vaccination services and prepare recovery. That's over a third, and you can see the other segments here. This is a small group, so we cannot infer or draw conclusions about what is happening in the country or what is happening. We can only say these individuals who were especially dedicated and interested, that they kept showing up and kept contributing and actually helped us build a Peer Hub. This is their situation. So it is going to be, even if we know the numbers and the proportions may change, we will keep in mind this focus because you are the founding group. You are the group with whom we built and are building this Peer Hub. You can see that 70% of you are involved in the COVID-19 response. The rest of you, there's nobody who's not and will not be involved. That was reassuring to see that nobody is joining this for the pleasure of being part of the pandemic response or the immunization dimension of it. Days per week was all over the place. A critical challenge. So these questions are actually the same as from the Pulse survey from WHO and the sort of complementary questionnaire that we also did with WHO on the critical challenges. So you can see here, they're actually referring back to what I showed earlier. There hasn't been a change. What's interesting is in the narratives here, there's some very interesting responses which we've just begun to analyze and will gear up to analyze when we scale up and open up the applications. Now, interestingly enough, almost a third of you are in the core group, and are not Scholar alumni. So we were very much hoping for that we could bring in people who are involved in the COVID-19 response, but who are not Scholar alumni, ensuring again the diversity of the peer hub. Yes, the sort of foundation is the Scholar Pledge to achieve impact. Yes, there's a number of additional commitments that each of you has to really sign, and there's a sworn statement in the application, but we're pleased to see that it is not only people who have already been through the Scholar program who are interested in this and have been committing since the series of 3 public global events that we held who've been committed. Gloria, I apologize if the screen is blurred. Okay, I see many of you. All right, and it is a Zoom issue, unfortunately. I recommend, Sohini has suggested going to see on Facebook Live, which is a good suggestion. Sohini, if you could share the link to the live, and perhaps it'd be easier for some folks who are having bandwidth issues to follow that way. Now, we're also doing network analysis with our research partner, and so that was the point of these questions. How often do you communicate with scholars? And basically, you're communicating a lot with each other, which we already knew from last year's evaluation. But this time, we want to see, we should be able to measure to what extent it actually makes a difference or not to be a participant in the network in terms of how you're able to respond and contribute to the work that your Ministry of Health is asking you to do, and that your more immediate bosses, our supervisors, are asking you to do. That is the point. This is not a course. So it is about really helping you with supporting you by providing this network, access to a network with what will actually help you get the job that you're focused on done, not learning something new, but really problem solving at the point of work where you are now with the problems that you have, with the problems at hand now. And when you make a breakthrough, when you find something, when you manage to get something done, to be able to share it back to inspire others to show that it can be done, even in in the face of a pandemic. So David Nusrat Shakar says that he's now on Facebook from Zoom, and that the broadcast quality is better. So I'll skip over the social networking questions. These are of interest to us, and we'll be sharing the results. They should also be of interest to you at some point. Now, half of those of you who are in the core group participated in last year's Impact Accelerator, but the other half actually did not. So that's more than the 30% who are not scholars, which was interesting as well. Obviously, some of you, I imagine, have been brought to this because you are involved in COVID-19 work. You are trying to figure out how to maintain or how prepare recovery for immunization services, and you see this as potentially useful to those goals that you have. How are you doing with implementation of the project? So that's the Impact Accelerator project for those of you who were in the Impact Accelerator. The important part here is that a quarter of you have stopped working on your project and state that it's the ways in which you're being affected by COVID-19 that is preventing you from going further. So this is having a significant impact on a group of people who had 644 people who had committed to achieving impact by taking their course project and implementing it. And a year later, despite the progress you had made, some of you have been stopped in your tracks. So we're also going to try to see through the Peer Hub how we can maintain that as well. If you had a good project around inequities or routine immunization around based on the GRISP guidelines, whatever, or on data improvement, to make sure, find ways in which we can support each other to go further than that. And then you can see here, again, one of the reasons to commend the team leaders for their first year of service is that many of you, more than 2/3, have participated in at least one meeting of scholars from your country. So a meeting of the country group usually. I only have about a minute left, and we do have a great set of questions that I'm going to be able to share with you. So, and yes, and this is the good news for team leaders, some of whom may be tired, or you may be finding it difficult to sustain the commitment. I don't know if there are actually any like that, but or just to strengthen the work that you are doing. You can see that in the core group, 30 people basically said that they were ready to volunteer in support of the team leader to help you do more, do better in your team, and 14 people are actually ready to volunteer as team leader. In some cases, creating new country groups, and in other cases, offering their services, to help with succession for the existing team leader. And then a few of you said that you felt ready to serve as COVID-19 focal point. Now, of those who volunteered, who expressed interest in that service, a third of you are national EPI staff. And with respect to COVID-19, a quarter of you are national COVID-19 response staff. And that seems especially important to us. It's one of the lessons learned. Now, many of you say that you're willing to spend inordinate amounts of time to serving your country's scholars. We ask you again, one of the lessons learned is to be reasonable. And now we have team leaders with experience who've been successful at getting certain things done, developing the relationship with a national EPI manager, convening and maintaining, sustaining the momentum of the country scholars. And we're going to turn to them to share with the new team leaders their experience and what they have learned over the last year. Now, here, these questions also mirror the ones asked in the Pulse 1 survey. So you can see here 70% of services are continuing in a limited way. So again, this is very limited data. It's for us a very small sample. We got over 1,500 responses in the survey we did with WHO in April. But still, this tells us something about the composition of the core group. I'm going to stop here. In order to turn it over to one of my esteemed colleagues. And I want to ask Charlotte or Alain, are you ready? Which of you is ready to share your screen at this moment? Let me stop sharing mine.
Hi, Reda. I don't know if you're getting me. It's raining cats and dogs here, so I may be having a sound problem.
Okay, all right. So it can't be Charlotte. Alain, are you ready to go? Oh. All right, Alain,
Okay,
I thought I had.
Okay,
Yes.
Reda, no problem.
Okay, wonderful. Thank you. So let me share the questions in the chat. Meanwhile, so whilst you're switching over, and thank you. Apologize for the somewhat rude interruption, but there's a meeting I was not able to escape in order to be with you, which is where I would very much prefer to be.
Okay, so yeah, thank you, Reda. So what we will do now, we will just start that next session, the session where we want to hear about those who were, who were diligent enough, sorry, to fill the test application form. So let me just try to put it on a slide, so we'll be good to go. So the principle will be easy. So as usual, you raise your hand and then you will have to respond to the question.
So are you going to share your screen, Alain, or are you setting that up?
No, yeah, I'm trying to, yeah. Right. So this question. So I'm ready to share my screen now.
In the meantime, for Emmanuel Moussa, so right now we're working with Emmanuel. We're working with a pilot group, and basically these are the individuals who participated every week. But we will be opening up soon, and then you'll be invited. You and others will be invited to apply to join the Peer Hub. And Halima, I'm not sure why you're thanking me, but you're very welcome, and I appreciate your continued participation. Thank you. Over to you, Alain. And take care. Wishing you all well.
Yeah, thank you very much, Reda. So once again, I would like to, first of all, congratulate all of you to have taken your time, volunteer yourself to be co-author of the preparation of the P Hub, because we want a P Hub which is exactly the way you want it to be. So your contribution is really, really important. So today we would like to turn to this exercise. So you see the questions on the decks. So we are having the member of the IAB in the panel. So we would like to have your answers about the question on board, because we know that since we've done the survey, things may have changed in your context. So we really want to hear from you. So the first to volunteer to respond to the questions is Mohammed Imran Qureshi. For your information, he's one of the team leader of Pakistan since last year. He's always volunteered to to contribute. That is how we do in this in that scholar community. So I would like to invite here Mohammed. Mohammed, can you hear me? Good afternoon or good evening.
Yes, Alan, thank you very much. Can you hear me?
Loud and clear. The floor is yours.
Thank you very much, Alan, and good morning, good evening, good afternoon, the scholars from around the globe. So coming back quickly to the important questions which is in front of me. So frankly speaking, this since April 2020, the immunization program around the world has faced the music of this COVID-19 pandemic challenge. And the challenges to me are threefold. Primarily, the challenges, the services which are either suspended are limited and not to the normal extent. So this is just one. The second aspect is for the supplies. I'm sorry for interruption. The second aspect is for the supplies, mainly the vaccines and other logistics. And the third aspect is from the community level, where the people have fear of going out for vaccination, and they either if don't have fear or they have certain lack of information if the services are continued or discontinued. So these are three aspects, and all of these three aspects adversely affected the coverage, immunization coverage. And we are analyzing this coverage from the start of this pandemic on daily basis. And we have noticed that the coverage is going up and down, and certain actions which we have taken is just helping us to improve the coverage. So this is the overall for question number one. I'll be going to question number for question number one. I also want to add that where the coverage has got down, but also we are seeing that the VPD surveillance is also struggling. Surveillance is not performing up to that mark where it was just before the pandemic. See, the urgent priority in the face of the pandemic, the best and the most important aspect is to deal with all these three parts of the challenge for this COVID pandemic, regarding the restoration to the optimum level about the vaccination services, fixed outreach, and then the struggle is to give and provide vaccines in the required number of doses to the end users. And the third urgent priority was to address the fears of the community and to provide them the optimum information which they require to bring their kids towards the vaccination centers. So these are probably the three priorities as far as the program is concerned. But I still recall my government director EPI, who was just discussing with me that if at all we are not being able to improve the immunization coverage, but we will be trying our level best to at least sustain the gain, sustain the coverage, and let's go for the strengthening of the system, so that once the COVID pandemic challenge is subsided, we are in a position to enhance and move with a faster speed. So this is for the second point. So coming back to the third point, which is important, peer hub. So frankly speaking, this peer hub is helping a lot. Like there are many new initiatives, new ideas, and challenges are being discussed at length, and we are getting new insight. And this is guiding us to the path where we can achieve the optimum coverage, improve the coverage, and address the challenges which we are facing these days. So the contribution towards the peer hub and how uh, definitely we will try to improve the coverage by engaging different stakeholders. And this peer hub providing many new ideas and many sports. So we will be using that ideas and sport, and definitely it will be like massive sport to us. So the next one is expect from other scholars in other community. People, if they are in the platforms like Geneva Learning Foundation, like COVID Peer Hub, they are, like, to me, connected, and they are even more closer as they were without these platforms, and they are sharing their challenges, they are sharing their solutions. So in that way, like, collateral sharing is definitely helping a lot. So this collateral sharing is giving strength to each other to deal with their challenges and to resolve them to a maximum extent. Then the recruit from other colleagues, and what means, definitely we are here to get engage all our country teammates and scholars, and just discuss with them what are the challenges they are facing and how we can just address them and move forward. Then difference do you think that will be make to contribute to the peer hub? What difference can we make together? Yes, definitely teamwork. Together we can achieve whatever has not been achieved alone in silos. So in my opinion, we should continue with it, and we should also open up for the international immunization scholars and leaders, so that they can contribute, they can think critically, and they can guide us on its pros and cons, about its utility, about how to improve it further. So the world immunization scholars and leaders, I have seen many other platforms and groups. So they are there to support, and many immunization bodies are there. So in my opinion, if these immunization bodies, experts, technical advisors, if they are also engaged, they could probably guide us in a better way, and they can also get insight from these ideas and peer hub. Thank you very much for the valuable time.
Thank you very much, Mohammed. And like Mohammed, we used to see you contributing. Those questions are there to help us to contribute to what we are doing, because we really want the P-Hub to be something, not another platform, but something that we are using um, every day in our work, something that is helping us to address the challenge of the COVID-19 at our place of work. So I will stop here asking you to stay with us. I will turn myself to first Francois Gas, and then secondly to Jan Steed, if they have some comment about your presentation. Francois, then Jan.
Good morning or afternoon, everyone, or good evening. Thank you for giving me the floor, but I'm reading with interest what has been shared. And I found personally very interesting to see that the problem of immunization is shared between the service providers, donc in health facility with vaccine, between those providers' problems, the fear, and the mothers not coming. And I think this balance sounds, it's very different from the perspective that was explained by the Francophone group, where there was a tendency to allocate the majority of the problem to the mothers. And I think it's a mix, because one may not be solved. The problem of the mothers may not be resolved until the service provider are solving the issues for themselves, And so I think it's the beginning of unwrapping the problem and the weight of each problem, which may vary from one country to another, may vary from one health center served area to another. I think I realized that the beauty of exchanging ideas and mutually supportive, and as he always says, you go far further when you are together than when you are alone. And I think this creates maybe a group of people who are going to share their solution, their problem, the failure as the success, and it can only help in the future. I see another point that seems to be important. Of course, I don't know the situation, that it may vary of the scholars in each country. There may be a big group, some may be more at national level than at local level. I was a bit concerned to see that there was still a low percentage, unless I misread, of people involved in immunization. So this is anyway a competence, but if we want to do better on immunization, if your job is related to immunization, maybe it will lead to a better success than if you're not in immunization, but maybe there's something I missed here. And I would say that the more numerous you are in scholars to join this effort, the better will be the results to restore immunization services. And I see an eagerness to build the optimal number of scholars to work together. So thank you. These are my observations. I may be wrong in some analysis, but thank you very much.
No, you are not, Dr. Francois, you are not. So thank you very much, Imran. So I saw his question in the chat box to add about what we were doing. So who will you recruit for? The recruitment is like Imran said, from among your colleagues, and by one means it's about recruiting to participate in what you are trying to achieve, maybe using the country group or whatever structure you put in place. But for us here, we are talking about, as you know, the country group as a team leader. You know that the country group, since we've done that for the accelerator, was a mean for scholars to put themselves together to, like Francois just said, create a synergy behind a scholar so that he can have some technical support or even advocacy support in what he's trying to achieve. So yes, we can see that in the chat box we have a lot of comment in what just said. So we really invite you to raise your hand and then share your comment with us loudly. And we also have Dr. Francois here, and he will be happy to give some insight about what you are saying. So I can see that Fatima Hussaini, she commented about caregivers not having NEP or bringing their children in Nigeria, especially northern part of the country. Rather, they are not happy about the way government is handling their need during this COVID-19 pandemic. So we really want to capture all those experience and share. So Fatima, good afternoon. We're really happy to welcome you. The floor is yours. You can either take the questions or explain your idea and share your idea with us or your experience. Fatima, you just have to click on your mic. You will be unmuted.
Hello.
Hello.
Hello, can you hear me?
Loud and clear. The floor is yours.
Okay. Good afternoon, all. So I'm very glad to find myself in this useful group. I wanted to talk on the issue why caregivers are not interested anymore in bringing their own children for immunization, especially in Nigeria, especially in northern part of the country. Is that first, they don't know much on the importance of immunization. The only thing they know that take your child for immunization, at least there is need for a mother to know, okay, this immunization is prevention of this and that. That's one issue. And then the second problem is that during this COVID pandemic, they were asked to be locked. So during the lockdown, they were suffering a lot. Instead of government, the little that was given to the government to be distributing or share among the destitute, unfortunately, the things has not reached the expected target population. So their complaint is that all the time, why are they being supposed to have if their children are sick, if they took them to the clinic, they must bring them not to accept immunization. So I think if whatever or to be shared among your people, make sure you have done justice for that. But majority of them now they are having issue of hunger and they were locked down. Nobody cares about what they are needing. So what is the essence of them to bring their own children for immunization? So I think this play a vital role. The government of Nigeria should know how to handle these people. They should know that it's not only immunization that prevents the deaths of our children, because prevention of childhood killer diseases is not only for immunization. There is nutrition is there, oral dehydration therapy is there, medications, some important medication that they need. But all these things, they are not, they don't reach them. So I think there is need to call the attention of the government to look into it and then make something useful. I think that's what I will just say about it.
Yes, Fatima, I'm absolutely correct. So thank you for sharing that. That's really an important matter. I would like to collect more. I can see that we have many of us who really want to share something. I will ask Dr. Francois to wait to, to keep what you've said now about, caregivers. That's really important, Fatima. Let us tune first to hear from Martha, then we will come back to Francois for comment about what you are saying. So that's really important. And then I will ask Elizabeth. I can see a lot of comment, actually very interesting comment. I would like to hear from you. So Elizabeth, get ready. Martha, can you hear me? Good afternoon.
Yes, hello. Good afternoon. Hello, everyone. Thank you. I think I'm Martha from Cameroon. Since April 2020, we realized from the first quarter, because we had the pandemic reaching Cameroon in March, early March. So from March to April, we had some drop in a kind of drop in the coverage in our region. And up to that, and then later after, we realized from last month, June, we realized a kind of a gradual increase in coverage. This might be partly due to the period that was scheduled during that period, because it's also a conflict zone. So, but during the period, we realized that communication was really a problem with the rumor of a clinical trial for the COVID-19 vaccine. So the most urgent priority in the face of the pandemic is to work towards effective communication to debunk some of those rumor beliefs that we have in our communities. And the peer hub, from the peer hub, especially in the idea engine, I can say I've seen how some other people in some other countries have handled this issue of communication, and I think we'll still have to learn more from the peer hub on communication, because I think communication in this aspect in our own setting is the key. To contribute to the peer hub, I think we'll have to share our own ideas, what we did as a country or as a region, what we did, how we overcome some of the barriers, and what we register as success. I think that one may apply to some other parts of the country and also other parts of the globe, so that they can improve on their own challenges. What I expect from other scholars in our country is for us to come together with a uniting force and put our voice together, our ideas together, and also share amongst us and those out of the country, those in the globe, so that together we can fight the barriers that COVID has come with against the immunization activities. To recruit colleagues, we in Cameroon, we usually have, since May, we have our meetings every 2 weeks, once every 2 weeks, where we have presentations from scholars on what the frontline scholars on what they actually do in the event of COVID and how COVID has affected their work. And we brainstorm together. We have ideas from colleagues who are in and out of the country. They present with what they have learned as an idea. They contribute and comment, and we learn from that. And we think that from this, we also encourage other colleagues, these scholars, to invite other colleagues who are not yet scholars, so that they should be part of this meeting. So the meeting is open. We open it for all health workers, frontline health workers, so that they should be part of it. And many other colleagues who are not yet scholars, so that they can be part of this peer hub. And then we have also involved, please, can you hear me?
Please.
We have also involved the regional delegate for public health, because he oversees for the Southwest region, or one region, but we are hoping to extend to other regions, because they oversee the work of the district medical officers, and we are hoping to have more of a district staff, because they are really the frontline workers. So they are part of this our country meetings, and we are hoping that when these invitations will be out, they will extend. We'll see how they can help us to extend, especially to the district medical officer. We are thinking that what difference do you think we make? We are thinking that if all these ideas they come together in the country and out of the country, that's around the globe, we can together combat the challenges that COVID has brought with our immunization activities, and then we can therefore improve on our coverages. Thank you.
Yeah, thank you very much, Martha, and thank you also, Fatima. We'll have other Fatima. So Fatima and Martha, please stand by. I would like to invite Francois. Francois, if you have some few comments for the two case study, we have what is happening in Nigeria, and then what just Martha just explained here from Cameroon, the south and northwest regions. Over to you, Francois.
Thank you, Alain. I think the problems were very specifically explained. I think for the first one, I think it was raised that you cannot address one problem without looking at the other element of the problem. If there is a need of the mothers to go beyond just being locked down, they have children, they have nutrition issues, and there is no, and you don't address those other issues, it's obviously create a major problem to overcome. What I'm not sure is how is this going to be overcome, but obviously the solution will come from maybe exchanging views and solutions that may be very context specific, but others' experience will help a lot. And I wish good luck, because I understand that. I've been living the same issue here between general healthcare services and asking everybody to stay home. And then it created something very complicated in practice in the field. We were just hoping that COVID will go so quickly that everything would go and return to normal. That was the dream here, because we failed to convince government to do additional things and not just focus on exclusively on COVID. So I think you raise a very specific problem, which I'm sure affecting many other countries, and together you may find some pathway to get a solution. For the second, I think you stress something that everybody is aware of, is that it's a communication. And I think communication maybe was downplayed before COVID and is back on the scene as a top priority. Now, communication is based on people communicating with another, listening well, getting the why and the why of the why of people affected, and seeing how you address rumors and everything that are now on the table. What I'm not so sure exactly is how this is going to take place to lead to the results, and how easy is it to implement, how easy is it to prioritize the group, the audience, the way, the methodology to convince, the message to give in. And I think as you move and you share with other, as you mentioned, the other peers, it may be, you may end up finding some solution again, thanks to this togetherness between scholars. And increasing the number of people, your base, I think is, I'm sure, the right way forward to have a very wider impact and a wider share of solutions. Thank you.
Absolutely, Francois. Thank you very much. Absolutely, by also engaging health authorities. I heard that they are engaging health authorities and using the platform to disseminate important message for the Ministry of Health. I think that scholars using the digital platform that they master already during the courses is very important to understand how that can contribute to to improve or to contribute in the fight of COVID-19 in countries. Thank you, Martin, Fatima. I will turn myself to two more. We have 7 more minutes left. So I will ask Lucy Kanja with her important comment she put on the chat, but also Shalini to get ready. You have maybe 3 minutes, each of you, I'm sorry, but because of the time, 3 minutes to present your answers. Lucy, after Shalini. The floor is yours, Lucy.
Okay, I'm Lucy Kanja from Nairobi, Kenya, in immunization program at subnational level. And straight to the answers of the questions, what has changed from for us since April? We compared the data of January to April last year and January to April this year, and we realized there is a huge drop, especially in measles, rubella 1 and 2. Although even other antigens are affected, those ones were hugely affected. And therefore, we planned, our urgent priority was to ensure that we are reaching the areas that had very high dropouts. And so we did an immunization micro planning, and we realized that the huge numbers were in the urban slums. And so therefore we planned with the help from UNICEF through Kenya Red Cross Kenya, targeted outreaches in those urban urban slums, and therefore taking services closer to community. But as we were doing those outreaches, we adhered to COVID-19 IPC measures of social distancing. We were doing COVID triaging, even as mothers were bringing their children for the outreaches. And we got so many cases out of those outreaches of the children that had dropped out. In the area where I am, we did a total of 18 of them, and that has increased the number of May and June reports because we were able to reach them where they are. So we were asking them why they were not coming to facilities, and they said when they were, there was a call to people stay at home, it was safer there, so they thought it was safer even with their children at home. So when we went near where they are staying, they were able to bring the children. But now we have added the discussion that even at our facility level, we are observing the infection prevention and control measures. So it is safer for children also to be brought at health facilities. And we have put even social distancing measures even at health facilities. And how can the peer pub help to address this priority of us? We believe that when we come together, we'll be able to share the best practices. We can brainstorm the challenges that we are having, and we see what has worked best. I remember like when we went out to those outreaches, we did, our sub-county did very well in HPV coverage, where some facility had 0, and they got like 40, 60, others even 100 girls turning up for vaccination. And so we shared amongst ourselves in the groups that we have in the API how we reached the girls, and we have seen other sub-counties replicating the same and getting also the numbers. So this will be helpful, sharing challenges, best practices, and it will ease. Then what do you expect from other scholars in my country? I expect that because of the knowledge that we are gaining, we'll be able to build a team and strengthen immunization services amongst ourselves, and also we share with others who are not yet scholars, and that will be helpful. So that is what I wanted to share, and it is working. Now we have embarked on, after finishing the outreaches, now we have embarked into mentorship, and because we have a directive, we cannot have a group of more than 15, so we are doing facility to facility mentorship. We are doing micro planning in the facility. Like today we visited 2, we did their micro planning, we assessed their prioritization matrix, and we see where the gaps are, and we have realized each facility have unique challenges, and so you address them differently. So that one is also working, and we are seeing staffs even appreciating more and even ready to go out of their way to make sure that their target population is able to be reached by vaccination. Over.
Yeah, wow. Lucy, thank you very much. I'm still wanting to listen to what is happening there to capture that experience. It seems fantastic. So because of the time, I will stop here asking Shvaleni to come back on Monday. We will hear from here, but also Fatima wanted to talk about something that is really important for her to understand. But I'm thinking that we can do that next Monday. We want to talk about the situational report of the COVID-19. We invite you to come with us next Monday, Fatima, and share that with us. Thank you so much. I will turn to Francois. Francois, you listen to what Lucy was, the experience of Lucy. It is very interesting. Please, your comment.
I agree. It's a very interesting experience, and I noted the kind of a few things very important. There is a message that it is health facility specific, the problem, and we should not treat all health facilities the same. And that, I think, is a very important message from Lucy. And I heard that you building a team with having scholar and non-scholar, and I think a team will make stronger results than one person alone. And as you mentioned, like it's been mentioned several times, that the sharing of issues and way to solve will be definitely bringing results that we expect step by step. We learn from failing and we learn from success as well. I was interested in the fact that you raised the issue of outreach. I have heard at the beginning of the COVID, there was a lot of outreach did stop. The health worker were also maybe misinformed and not carrying the outreach. We have heard many examples of outreach dropping by 80%, 100% sometimes. Now you have reestablished outreach and become opportunity to communicate with the mothers about what has changed. And you focus on making sure that service delivery reflect what the concern of the mothers. So I think it's a very good example of the combination of offer services and utilization of services by addressing the needs of the health workers and the need of the mothers. So I think, thank you for sharing this experience, Lucy.
Thank you, thank you.
Yeah,
you're welcome.
All the best. And that is just the beginning, Lucy. We still have our platform. I'm really happy that we hear from Cameroon. We are hearing from Kenya. What we learn here, we want to share. It does make sense if we share it. It's important to share the ideas. We all want to share what is working. We want to help. We want to contribute. So that was really interesting to hear from you. I encourage others who was not able to talk today to really prepare the story for next week on Monday. We will together here and then listen to each other, because we really want the P-Hub to be tailored to our need. It's really important that we understand that once we have the country group, we have already experienced scholars here who are using country groups with digital skills to really conduct training or share information, invite authorities, health authorities to disseminate guidelines and all that. So that is how we can walk that extra mile of contributing better with what we know, our digital skill, because we know that the social distancing and all that, we can use that opportunity to also conduct trainings or even share messages. So thank you very much. I will stop here abruptly because we are 2 minutes out of time, and you know that time management in Scholar is really important. I will stop here and say thank you, first of all, to all the team leaders for volunteering to fill the report of what is happening at the country level, but also you in the room here co-authoring the P-Hub. Your contribution is most wanted, is most needed. And in the name of all the Scholar team, Reda, Ian, Steve, Charlotte, Ja, and all those who are in the background, I would like to really thank you and invite you to come next Monday at the same time so that we will have more tremendous experience shared by colleagues. That's it. I wish you a wonderful week. Stay safe and see you on Monday.